Hey, Dr. McNamara here, and I want to talk about a knee injury that is common, overuse injury in runners. It can also occur from any bent leg type of trauma affecting the lower leg or the upper leg. The muscle involved in this injury is known as the popliteus muscle. First things first, you want to rule out other type of pathologies when treating the popliteus. Make sure it's not meniscus, make sure there's no damage to any structures within the actual knee capsule, as well as ruling out IT band syndrome as well, because that can cause some of that lateral type of knee pain as well. But for the popliteus, the primary location of the pain is the posterior lateral side of the knee in which it attached, and the action of the popliteus is to internally rotate the tibia on the femur, so then we can bend the knee. Because when we straighten the knee, it locks out. This muscle unlocks it so we can bend it. Okay? So the first thing you want to do if this muscle is irritated, we're having some popliteus tendinopathy, you want to take something like a tennis ball, lacrosse ball, something hard, and kind of massage that muscle which lives right into that knee pit, and just kind of mobilize it like that. Do some internal, external rotations, and this will help release that popliteus muscle. Once you get some good mobilization from a ball, we want to stretch the popliteus muscle. And the way we're going to do that is we're going to grip the ball of our foot, and then we're going to slowly extend it out just like that. And now I'm feeling the stretch right back here in the pit of my knee where that popliteus muscle lives. All right, so after we have released the popliteus muscle and we've stretched it out, we then want to work on the anterior portion of the knee, and that is that quadriceps muscle. So we want to stretch that out, and then we'll work on some terminal knee extensions just to make sure we have that full range of motion of that knee joint. So I'll show you how to stretch the quadriceps muscle with my left leg. What you want to do is you want to find a wall, and then you want to take a knee against the wall. Stay in a forward flex position while we're getting into this position in order to not strain anything in the quadricep. And then when you have your foot plantar flexed, top of the foot against the wall, knee on the ground, you then want to work on extending the torso until you feel a nice stretch in that front of the leg. So I'm feeling a really good stretch in the quadriceps muscle right now. So I'm going to keep it here. If I wanted to make this stretch more intense, I would move my knee closer to the wall, okay? So as I mentioned earlier, the popliteus muscle is responsible for unlocking that knee so we can then bend it. So what we need to work on is ensuring that we have what's called terminal knee extension in order to rehab this muscle properly so that this injury doesn't occur again. And what terminal knee extension looks like is when your leg is flat against the ground, you can contract the quad muscle and you can see my heel coming up like that. If you lost this ability to lift your heel up by flexing your quad while your leg's against the ground, that's indicative that you need to start doing this type of exercise. Otherwise, we may start experiencing symptoms of knee pain. So to regain that terminal knee extension, what we want to do is you want to kind of internally rotate an internal rotational force on the tibia. So I'm kind of pushing it in a little bit, okay? Then when I contract my quadriceps muscle, I'm going to push downward in order to initiate and mobilize that terminal knee extension. So I'm turning it in, and then when I contract, I'm going to push that foot off and push down with my hand. Make sure you got a good grip. And that will ensure that you have the proper length tension relationship in that knee joint. So if you're having lateral knee pain, especially in the posterior lateral, you're having any type of pain going up and down stairs, up and down hills, make sure to get your knee checked out by a certified professional and see if it is that popliteus. And if it is, these exercises will help you recover from that injury.